Imagine you're lying on the ground somewhere in ancient Peru. A figure kneels beside you. They pick up a stone blade, obsidian, volcanic glass, sharper than anything you've ever touched. And then they begin cutting into your skull. No hospital, no anesthesia, no modern medicine of any kind. Now, here's the question that should stop you cold. Did you survive?
The answer, backed by physical evidence examined by researchers at Tulane University and published in the journal World Neurosurgery, is yes. In fact, there's an extremely good chance you survived. Up to an 80% chance. And that number isn't just impressive for the ancient world. That number is better than what American surgeons were achieving during the Civil War, thousands of years later, with metal instruments, formal medical training, and published anatomical textbooks.
Let that sink in for a second. Prehistoric surgeons operating with stone tools in the Andes outperformed 19th century doctors operating in what we consider the dawn of modern medicine. This is crazy. We have been dramatically, almost embarrassingly wrong about how sophisticated ancient humans really were. And the evidence has been sitting in the archaeological record the whole time, carved into bone, preserved in dry mountain air, waiting for someone to actually look. Today, we're looking. This is the case file on ancient trepanation, the oldest confirmed surgical procedure in human history, and what it tells us about the minds that performed it. Stay with me, because what comes next will completely change how you think about the ancient world. So, what exactly is trepanation? The word itself comes from the Greek word trepannon, meaning borer or auger, and the procedure is exactly what it sounds like: a hole, deliberately cut, drilled, or scraped directly into a living person's skull. Not to kill, to heal. The oldest confirmed evidence of this procedure dates to approximately 7,300 BCE. That is more than 9,000 years ago. And here's what makes this genuinely staggering. It wasn't isolated to one culture, one continent, or one moment in time. Evidence of ancient trepanation has been documented in France, Germany, Portugal, Italy, ancient Greece, Russia, China, Africa, the South Pacific, and across North and South America. This is a surgical procedure that independently emerged in civilizations that had absolutely no contact with each other. Which raises a question that researchers find both fascinating and deeply unsettling. Why did so many separate cultures across so many thousands of years arrive at the same radical conclusion, that cutting open a person's skull could save their life? The most credible answer from the archaeological and medical record is also the most straightforward one: because it worked. And because the people performing it were far more observant, far more skilled, and far more intellectually sophisticated than history has given them credit for. Now, let's talk about the skull. In the 1860s, an American archaeologist traveling through Cusco, Peru, came across an ancient skull pulled from an Inca burial site. It had a large rectangular hole carved into the top. He brought it to New York and presented it to medical professionals. The room was skeptical. They didn't believe it was possible that an ancient person had survived this kind of procedure. So he sent it to one of the most respected surgeons and anthropologists in France at the time, a man named Paul Broca. Broca examined it carefully, and his conclusion was unambiguous. The bone around the hole showed clear signs of healing. This person had not just survived the surgery, they had lived long enough, weeks, possibly months, for new bone tissue to begin forming around the wound. That single skull cracked something open in the scientific community. And what followed was one of the most surprising archaeological discoveries of the modern era. Trepanned skulls began turning up everywhere. France, Germany, Austria, Palestine, China, and most dramatically, Peru. To date, over 800 trepanned prehistoric skulls have been recovered from Peruvian burial sites alone. That is more than the rest of the world combined. And it's from that extraordinary collection that researchers were able to do something remarkable. They could actually track the evolution of surgical skill over 2,000 years of practice. Here's what that data showed, and this is where it gets truly extraordinary. Between roughly 400 BCE and 200 BCE, ancient Peruvian surgeons were achieving survival rates of around 40%. Not great by modern standards. But remember, these are people operating with stone tools on the human skull, with no germ theory, no antibiotics, and no formal medical tradition as we understand it. 40% is not nothing. And crucially, they didn't stop there. By around 1000 CE to 1400 CE, that survival rate had climbed to 53%. And during the Inca period, roughly 1400 to 1500 CE, the evidence suggests survival rates reached between 75% and 83%. One exceptional cluster of skulls from the Northern Highlands showed a survival rate of 91%. Let me put that in direct comparison. American Civil War surgeons, working between 1861 and 1865, had access to metal instruments, formal training, published medical textbooks, and rudimentary knowledge of infection. Their mortality rate for similar cranial procedures ran between 46% and 56%. That means more than half their patients died. Inca surgeons, working with obsidian blades and copper knives, were losing fewer than 1 in 4. The question researchers keep coming back to, and it's a genuinely profound one, is how? How did they get so good at this? What I kept coming back to, through all of this, was a single word that explains almost everything. These surgeons weren't working from textbooks. They were working from observation. From the accumulated memory of what killed patients and what didn't. From generations of knowledge passed directly from master to student, refined over centuries of real outcomes. And the physical evidence of that refinement is written directly into the bones. Early trepanation attempts created large, irregular openings. The tools scraped deep, sometimes perforating the dura mater, the tough protective membrane that sits between the skull and the brain. When that happened, patients developed infections and died. Over time, something changed. The holes got smaller. The technique shifted to a method researchers call circular grooving, carefully carving a precise circular groove around a section of bone, gradually deepening it until the disc of bone could be lifted out cleanly. And the surgeons learned, through painful trial and error tracked across generations, which areas of the skull were safe to open and which areas were lethal. They gravitated toward the parietal bones on the sides of the skull, away from major blood vessels and critical brain regions. This is not random. This is empirical medicine, the result of careful observation and incremental refinement over an enormous span of time. There's one skull in the record that makes this point more powerfully than any other. A single skull showing 5 separate trepanation holes. 5. And every single one shows signs of healing. This person underwent brain surgery 5 times using Stone Age tools and survived every procedure. That is not luck. That is skill. Now here's what makes the infection question so fascinating. We still don't fully know how they controlled it. The field hospitals of the American Civil War were breeding grounds for bacteria. Surgeons moved between patients without washing their instruments. They probed wounds with unwashed fingers. Germ theory was still contested, and infection was routine. Ancient Peruvian surgeons, working in open-air environments with freshly made obsidian tools, may have accidentally practiced better infection control than their 19th century counterparts, not because they understood bacteria, but because the conditions of their practice happened to minimize contamination. Freshly knapped obsidian, it turns out, produces an edge so fine it can be sharper than a modern steel scalpel. It's also essentially sterile when freshly made. As for pain management, we honestly don't know for certain. Researchers suggest coca leaves, which contain the precursor to cocaine, may have been chewed into a paste and applied to the surgical site as a topical numbing agent. Other plant-based substances with analgesic and sedative properties were available in the Andean pharmacopoeia. But there are no written records. We can only reason backward from the evidence, and the evidence tells us that whatever they were doing, it was working. And because of that, the question of why they performed this surgery becomes even more interesting. The most well-documented reason, supported by anatomical evidence, is head trauma. Ancient warfare, clubs, slings, blunt weapons, produced exactly the kind of injuries that trepanation could address. Skull fractures with bone fragments pressing into brain tissue. Dangerous swelling with nowhere to go. Surgeons who could relieve that pressure, clean out the damage, and give the brain room to recover. Those surgeons were saving lives. Some skulls also show trepanation without any visible sign of trauma. No fractures, no wounds, which suggests other motivations: chronic headaches, epilepsy, conditions we can no longer diagnose from bone alone. Some researchers raise the possibility of ritual or spiritual dimensions, given that certain cultures believed illness entered through the head, and opening the skull might release it. But here's what the data keeps insisting on. Whatever the motivation, the technique evolved in ways that only make sense if the surgeons were paying close attention to outcomes. You don't refine a surgical approach over 1,000 years for purely spiritual reasons. You refine it because you're watching what works. And this brings us to the most recent chapter in this story. In February 2026, archaeologists excavating an Iron Age hill fort site in England, the Wandlebury Hill Fort, associated with a University of Cambridge training dig, announced a remarkable find. Among a mass grave of disarticulated remains, they identified the skeleton of a young man between 17 and 24 years old, dating to the 9th century CE. He stood approximately 6 feet 5 inches tall, extraordinary for a period when the average man stood around 5 feet 6. His bones suggested a condition affecting his pituitary gland, one that would have caused elevated intracranial pressure and severe, debilitating headaches. And his skull bore an oval hole, roughly 3 centimeters across, consistent with deliberate trepanation. The analysis by researchers at the Duckworth Laboratory at the University of Cambridge suggests this was almost certainly an attempt to relieve that pressure. The same goal that surgeons in Peru, France, China, and Africa were pursuing, using the same fundamental logic across thousands of years and thousands of miles of separation. The same conclusion, reached independently. That thought alone is remarkable. But here's what I find most compelling about all of this. We inherited a story about ancient humans, that they were primitive, that they were reactive, that they were doing things by instinct, not by thought.
And then you look at the bones. You look at a skull with 5 healed trepanation holes. You look at survival rates that outperformed 19th century military surgeons. You look at a surgical technique refined so precisely over centuries that practitioners were making openings barely larger than necessary, deliberately avoiding the membrane that would have killed their patients without ever reading a single anatomy textbook. These were not primitive people stumbling through the dark. These were empirical thinkers operating at the edge of human capability with the tools they had, and producing results that should honestly make us uncomfortable about how easily we dismiss them. The reality is, we have been measuring ancient humans by the wrong standard. We keep asking whether they had our technology. We should be asking whether they had our intelligence. And the skulls are answering that question. They were answering it all along. So what does it mean that a civilization 10,000 years ago was performing brain surgery and getting most of their patients out alive?
I think it means the gap between ancient and advanced is far smaller than we've been taught. And I think it means there are hundreds of stories like this one, still buried, still waiting. If you've made it this far, drop a comment below with one word that describes how this made you feel. I read every single one. And if this kind of investigation is what you come here for, the real evidence examined without apology, then subscribe to Arcanum. New case files drop every week. The truth was always buried. We just have to keep digging.